The broadcast is now starting. All attendees are in listen-only mode.
Well, good afternoon, everyone. Thank you for joining today's webinar. In the email that I sent out last week advertising this, I think I'd indicated that this would take about an hour. It won't. Hopefully I should be able to get done with my part in about 25 minutes. And then if we have any questions after that, I'll be happy to answer those questions and then let you guys get back to your day. So feel free during the course of this webinar as I'm talking to type in any questions, and then I will do my best to get to each one of those kind of at the end. I'll address questions. So I'm going to do most of our presentation today on this website, exchangeplancomparison.com. This is just kind of it's a generic website that we own that I use for purposes really just like this. So as you can see, we have the marketplace, plans and quotes, or instant quote box, whatever it is you want to call it, right here on this website. So this will just work very well for today's illustration. So I'm going to start off today just by jumping right into the quote engine. I'm going to use an Idaho zip code, answer the tobacco question, just make up a date of birth here. Click instant quotes. And for today's purposes, I'm just going to exit out of the subsidy calculator. And then by default, once I'm now in the quote engine, I'm seeing all of the exchange-based plans. As you can see, if I filter by automatically, it just shows the exchange-based plans. So I'm going to change that in just a minute and show the non-exchange plans. But before I do that, I want to talk a little bit about our connection to the healthcare.gov website. Unless anybody's completely blind, you're very familiar that there still continues to be a lot of problems with the healthcare.gov website. And in fact, now they're saying that between 1 and 5 o'clock in the morning Eastern time every day it's going to be down for part of their updates. So part of what we are still working with is the connection that we have with them as a web broker, what we would call the API or the direct connection, where we can send those people that are applying for coverage over to the healthcare.gov website to complete the subsidy form or subsidy piece of the application. Right now, if you click Buy Now on any of your websites, for an exchange-based plan, you'll see the message that says FFM temporarily down. So on this plan, on this website, the exchangeplancomparison.com, I've actually disabled that so that if you go to Buy Now, it takes you right into the registration page. If I click New Applicant and put in an effective date, I can actually go right into the registration page. And the reason I've taken the FFM down is I just kind of want to show you guys kind of the next step of what's about to happen, or maybe it's a month from now, I don't know, whenever the federal connection starts working the way it should. The clients will fill out this registration page, which I'm sure many of you have seen. They click Save and Continue, and then they're going to go to this page, which indicates that they're going to go over to healthcare.gov to complete the application for a premium tax credit. And then once they click that, they're automatically redirected to healthcare.gov, and we know that this is not working because there should be another blue box right here that says Return to Issuer Portal. So what happens is your clients would come here, they'd register, then complete the subsidy application. A box that says Return to Issuer Portal should follow them all the way through the process. And then when they're done with the subsidy application, that box moves to the center of the page and becomes their only option. They come back to the portal, the quote engine that we have set up on your website, where they complete the plan verification. They verify that that's the plan they want, the effective date they want. Enrollment's completed, and then we send a file over to the healthcare.gov that includes your NPN number and FFM user ID. So the problem is without this little box here that says Return to Broker Portal, we can literally send your clients over to healthcare.gov right now, but if we do that, there's nothing that's going to redirect them back to your portal to complete enrollment, and then we send a file including your NPN number and FFM user ID. So Until this process is working right, your websites will continue to say FFM is down. Now, I sent out an email blast earlier today, which we've already gotten a lot of replies to, that is basically saying, well, I'm just going to pull up our Insurers of Idaho one to show this, but so here's what we're looking to do on this. If somebody clicks Buy Now where it says the FFM is down, after they complete this registration page, we're going to give clients the option of potentially then completing the paper form of the subsidy application that then can be mailed by the broker to that address that's specified on it. And when it's mailed by the broker, then it will, of course, automatically, when you print it out, it will have your NPN number and FFM user ID number. So we're hoping now to have that up and running by the end of the week, and just look for an email blast in regards to that. So we hope that's coming. We're hoping that that's going to be helpful to you guys. We don't know how long the connection to the FFM is still not going to be working properly. If something changes and it looks like that is going to start working properly, that of course will become our main focus. In the meantime, I also want to point out, I want to make sure that each of you have gone in under your Agency Central, gone to the My Account tab, Edit Agent Info tab. Hang on one second. Got to be logged in as an agent to do it. So if you go to My Account and Edit Agent Info, you need to put in your NPN number and your FFM user ID number. We need these numbers in here because any files that are sent automatically to healthcare.gov or any forms that are print off, such as the subsidy application, will automatically have that information on it. Okay, so back to the demo. The main thing that you guys are all in attendance today is to get a glimpse of how the non-exchange application works. So this is kind of why I've kind of skipped the subsidy step. We're going to assume that this client does not qualify for a subsidy, so we don't want to send it through the exchange. We want to send it directly to the carriers. By default, if you click Buy Now, it's going to go through the federal system. Now, we're working on that, whereas if somebody does not qualify for a subsidy or skips out of the subsidy calculator, we're going to give them an option once they click Buy Now to indicate which path they want to go. But until we build something like that in, what you need to do is go to Show Sort Filters, uncheck Exchange, and then in its place, check off Non-Exchange. Click Filter. Now it is showing only the non-exchange plans. So, for example, with Blue Cross, they look the same. Blue Cross's plans are the same inside and outside of the exchange. There are some differences. For example, if I scroll down, you'll start to see Coventry One plans, which are only available off exchange. You'll also see, for example, Regents Blue Shield plans, which are also available only off exchange. Now, there's a couple of indications that you're off exchange without looking at the filter section. First off, if you see Regents or Coventry, you know you are. The other kind of giveaway is that it says monthly premium. It doesn't say subsidized monthly premium. So if I actually went into the subsidy calculator, for example, and let's just put in somebody with 30,000 income, a household of 2, we now know that they qualify for a subsidy, but you don't see subsidized premium because we're looking at just non-exchange plans. So if I add the exchange plans back in, now you can tell because you'll see some that say subsidized monthly premiums. So you'll see the Bronze Connect with Blue Cross, $63.50, and if we scroll down here somewhere else, we'll see the Bronze Connect again, but it will be without the subsidized monthly premium, and it'll just show the monthly premium because we can literally look at both sets of plans side by side. So now we start to get into the monthly premium. These are non-exchange plans that we're now looking at. And you can see for example, all of the Blue Cross plans all over again. In this particular case, sorted by price. But for purposes of our example today, I'm going to go ahead and turn off the exchange ones. We'll look at just the non-exchange ones. It will be a little bit cleaner that way. And then when we click Buy Now, it's going to take us directly into the online application via the same registration page that your clients see if they're going to apply for an exchange-based plan. So we verified that it's a new applicant, a January 1st effective date, and I'm going to click Start Application. And to save time, I've already kind of pre-populated this registration information. All of this needs to be entered in. We do have some questions that are on here, such as Social Security number, that are not on the exchange-based plan one. I need to specify that I'm a resident of the state of Idaho for a non-exchange application, and all of the other information should be in here. Now I go directly into the online application. I have an option of adding dependents simply by putting in the required information, or if I don't have dependents, I can save and continue. There's a new question on here that's part of the Idaho Universal application, asking about workman's comp. I'm going to say no to that, click Save and Continue. Now ask about prior coverage information. Same thing, I can enter that in, or if I don't have prior coverage information, I can just save and continue. Then this section is going to come up and ask specific provider questions that will vary depending upon the provider that's been chosen, and in some cases plans within that provider. So in this particular case, we can tell that I chose a Blue Cross plan that's a connected care plan or whatever that has a PCP. So now I have to answer these questions. Am I in southwestern or eastern Idaho? And I'm going to say in southwestern Idaho, and that I already answered these primary care physician questions with Dr. Someone. And then I'm going to say, no, I'm not currently enrolled in Blue Cross coverage, save and continue. And then I have the fine print, but basically that is it. The non-exchange application process is literally that easy. Type in the client's name, specify today's date, and save and submit. In the email that I sent out last week, I indicated that this is phase one of a two-phase process. From your client's perspective, they are done. They are now going to get an email indicating that they have completed an online application for whatever Blue Cross plan it was. You as the agent are also going to get an email indicating that your client has completed the online application. Now the difference is during phase one, we're not automatically sending that application to the insurance carrier. You're going to have to log into your respective administrative panels and Agency Central or Connected Agent. When you go to the task screen and click on Open Applications, and actually I'm in the wrong login, so bear with me here for 1 second. There we go. Okay, so now now that I'm here, for example, if I refresh it, let's make sure we have the most completed one. Here's the Denver Broncos application as of 3:06 this afternoon, and we can see that it is completed. So during phase one, this is not automatically sent to the carriers. Somebody has to come in here, usually an administrator, and click the Send to Carriers button. If nobody clicks that, this application is just going to sit here. Now this, again, this is only phase one. Phase two, which we're hoping is launched by the end of this week, will actually automatically send that application to the carriers. But there's a couple of things that are still missing before we can get to phase two, and a lot of that pertains to payment processes with the carrier. So up here I have the big 5 carriers that are involved in non-exchange applications. Then the question is, are payments needed at the time of application? Now you can see with Pacific Source and Select Health, the answer to that is yes. Payments must be submitted with the application. There's no point in sending the application to either of these carriers without payment information. Both of these carriers have indicated to us that they will accept credit card payments as binders for part of this process. We are PCI compliant, payment card industry compliant, and so we can, in behalf of your clients, take this payment. The application will automatically be sent to the carrier along with the payment for the first month. Blue Cross, which in this particular case is a Blue Cross application, does not want or recommend payments at the time of the application. They'll take care of that later on. So if I go back to this screen, this application is literally ready to be sent to Blue Cross of Idaho, and if I actually touch that button, it would actually send it to Blue Cross. So I'm not going to do that. But Regents and Coventry 1, they have yet to specify, I don't know if they know yet, what their exact processes are. Do they want payments at the time of application, or do they want to collect that later? But for example, if I want to view this application before I send it to the carriers, then I can simply go to the Document tab. Let's say, for example, I'm going to download and view a PDF copy of this Blue Cross application. I can see, for example, now the forms that we're familiar with. Here's the Blue Cross application, cover sheet, all the specified pages of it. Actually, I've gone far enough into this. I went into the universal ones. So, okay, so the Blue Cross cover sheet here is page 1 and page 2, and then starting page 3 is the Idaho individual application. So without medical questions, this process really is simple. There's no subsidy being applied for. It's really just that simple. Now, a couple of things. This section right here, we will populate with the agent's name. We will put your Blue Cross ID number here, for example, and we will also put the agent's NPN number right here. We know that if we give carriers NPN numbers and agent numbers, then that's going to give them more than enough information to make sure you get credit. Each of you should have given us agent numbers for your specific carriers that you're appointed with at the time you signed up for the service. And then where it says signature of agent, will actually it'll put your name down there again in typewritten form. And then the certificate of digital security is sent along with that to the carriers, which all of the carriers have signed off on. So that, in a nutshell, is the process that we are using. Again, somebody has to click Send to Carriers during Phase 1 only. Once we get to Phase 2, it will automatically send the application to the carriers, and it will automatically send any payment that's required. When you come into the task screen, it will actually just show up here as a newly enrolled policy. And when you go to your client record here, it will, in that case, it will actually show as not an applicant status, but an enrolled client with a policy in force. One other thing I wanted to touch on, in the email I also indicated, as far as the administrative panel, a couple of additional functions that we were adding. We kind of had to pull back on that a little bit. That, as far as adding refer links, we haven't been able to quite get that working right, so we've kind of pulled back on that. So if that becomes available again, I'll reach out to each of you. But really, this is the key thing I wanted to show you guys today, is if you're inside of the quote engine, just remember that by default, when a client goes in there, they are seeing the exchange plans. You need to go in here into the filter and specify if it's non-exchange. You can keep the exchange on if you want, or show just the non-exchange plan. So the Buy Now button will take you to one of two screens, depending on if it's an exchange plan or a non-exchange plan. So non-exchange plans will go carrier direct. Exchange plans will receive the message that says FFM temporarily down, and allow clients just to complete the registration page. Really, at this point, I've done even faster than maybe I normally do, because that's really all I needed to show you guys today, unless there's some specific questions. I'm happy to answer any questions you guys may have. Again, I also want to point out that we've received a lot of interest as far as adding the paper applications on there and automatically for exchange, and automatically putting in your NPN numbers and agent names on these forms so that clients can fill out the paper version of the application until our connection to healthcare.gov is working the way it should be and we want it to. Just trying to see if we have any questions here. All right, I want to thank each of you for taking time this afternoon to join the webinar, and if you do have any questions, feel free to reach out to me directly. I will be more than happy to get back with you.